Rachel Haynes here from CTV National News. You mentioned today in question period that rapid tests are coming soon. Can you expand on that? How many rapid tests can we expect to see coming out in the next few weeks?
Well, I have some numbers here for Quebec, which is the next province right now in line to get a shipment of rapid tests. And today, more than 200,000 tests were shipped to Quebec. And these shipments will boost Quebec's testing capacity to almost 600,000 tests this week. And throughout October, we'll anticipate even more unfolding across the provinces and territories. They are on a distribution agreement that's been worked out between the provinces and territories. So 80% of what is received in Canada will be distributed through the provinces, territories based on per capita, and the federal government will hold back 20%, partly to serve our own populations, Indigenous populations, other people that the federal government has responsibility for, but also just to hold back some in case there is a significant surge or a province and territory needs extra help with a particular outbreak.
And can you tell, I know a lot of Canadians are wondering, at what point are they able to go into a doctor's office or go somewhere that's more accessible than an assessment center and get a rapid test? How quickly are average Canadians going to be able to get one of those?
It depends on the province and territory and the demand that they're having for testing. But generally speaking, these tests still require clinical applications. So people will still need to visit a testing center or a pharmacy. Some provinces and territories may choose to deploy some of these rapid tests in areas where they want to test more frequently, like in long-term care homes or other congregate living settings. Some may want to use them in other facilities where there are vulnerable people. And so really, it'll depend on the province and territory. Right now, each province and territory is, divining their own guidance based on their own outbreak situation and their own perspective about how to use those tests most efficiently.
Go, because I have to check something on the phone.
Oh, perfect.
Skip someone first.
Okay. Well, I'll ask. The charge was made a few days ago by Michelle Rempel that the government had reached out to Pfizer and to other companies to say, hey, we're concerned about this, and to get Pfizer to then write a letter expressing their concerns. Is that accurate? Did the government reach out to Pfizer and other companies? And have you heard from any other pharmaceutical companies other than Pfizer that they're concerned about this health committee?
I can't speak to that. I haven't personally spoken with pharmaceutical companies. I have obviously heard the concerns, though, raised by pharmaceutical companies and other companies, by the way, that produce personal protective equipment and other medical devices, that any release of proprietary information could, of course, jeopardize their own intellectual property. I think those questions are, in terms of where companies are at, it's best probably presented to the Minister of Procurement. But I will just say this, from my perspective, I want to reassure Canadians that we will not put their access to vaccines or any other medical devices at risk. And to the companies themselves, obviously, we'll work very closely to ensure that we're protecting confidential information that is sensitive to release publicly.
Nous allons maintenant passer aux questions au téléphone. Opératrice, est-ce qu'on peut rappeler aux gens quel bouton peser pour annuler une question? Je sais qu'il y a des gens qui se sont queués par erreur dans la ligne.
Oui, c'est le dièse pour enlever leur question.
Donc, si
Étoile 1 pour poser la question et dièse pour se retirer de la file d'attente.
OK. Est-ce qu'on a des questions en ligne?
Oui, certainement. Donc, our first question, la première question. Tanda McCharles, Toronto Star. Votre ligne est ouverte. Your line is open.
Yes. Hi, Minister. Sorry. I wanted to ask you, and you may, I saw your tweet yesterday about the mask picture that was put up on Twitter, but I actually would like you to explain exactly what was going on there. I couldn't tell if you were reading, were you having a conversation with someone? Could you explain what was going on at
Absolutely.
that time that picture was
doing
taken?
both. I was having a conversation and eating.
And so you feel you were, I take it from that answer, you're saying that you were within public health guidelines. Although
Yeah, absolutely.
Sorry, go ahead.
Oh, just the public health guidelines of Toronto Pearson say that while you're eating, you can remove your mask.
And so a follow-up, I'd like to understand, given the motion that's passed that now compels the government to produce the documents you were resisting producing and canvass the whole government's response on pandemic. I'm wondering, To what extent do you think that perhaps the government might have responded, or did you actually try to negotiate with the opposition by way of naming some kind of review or an arm's length inquiry into the pandemic response? And if it's not appropriate for this kind of probe to go on now, when do you think it would be appropriate for that kind of probe to happen?
Well, listen, I think that the response of the entire country to the global pandemic will be of critical importance to future governments, especially at all levels, actually, on how to deal with emerging viruses. In fact, the SARS report was very useful and resulted in the creation of the Public Health Agency of Canada. I can only imagine the kinds of recommendations that experts will have as they review the response of Canada to the global pandemic. In terms of negotiating with the opposition, that's not my job. I don't do that work. I can just say that we've been there at the Health Committee all along, providing testimony, providing documents, ensuring that people understood the rationale behind decisions and being accountable, and it will be no different after the motion.
And so the question of when it's appropriate?
When listen, I under regular conversations with Health Canada and Public Health Agency of Canada, we've got collection of our own in terms of, almost a historian type of approach where we've got people collecting documents and decisions that have been taken. We'll be able to, provide all that information in the eventual review. But at this point in time, I'm very focused on getting Canadians through this wave of the pandemic. We have a lot of work to do. Both Health Canada and the Public Health Agency of Canada are working around the clock to support provinces and territories in delivering healthcare, supporting people through the surge, making sure that we have the devices, working on procurement of vaccines and getting ready to deliver those vaccines. And I'm going to stay focused on those things because that's what matters to Canadians the most, and that's what's of most critical importance at this point in time.
So we have time for one last question on the phone. Operator, do we have another question?
Currently, there are no questions registered.
Thank you.
Okay. Thank you very much.